I'm going to be your care provider for today. Can you please tell me your name and date of birth?
I'm Shiloh Potts, and my date of birth is 7/18/01.
Alrighty, thank you. Well, Miss Potts, what brings you in today?
Well, I've had a fever for 2 days, and I'm not feeling very well.
Gotcha. So can you tell me of any past surgeries or illnesses? And can you explain your symptoms a bit more to me?
I do have type 1 diabetes, and I've also had flu-like symptoms last week, but they got better. But now I just feel really tired, and I feel like I'm going to throw up all the time. And I told you already that I am running a fever, and I have a stiff neck, and I can't really move it.
Okay. So when did these symptoms start appearing?
I started noticing them about 4 days ago.
Okay, thanks. So to me it sounds like you have meningitis. I can tell because of the most prominent symptom being a stiff neck. We'll have to run a couple tests to see what's causing it. So I'm just going to swab your nose and we're going to take a blood sample. Does that sound okay?
Yeah, that's fine. How do these samples tell you what kind of meningitis that I have?
So these samples we'll do a couple different tests, like a PCR test so we can look at the DNA of whatever's causing it to help specify the causative agent. We'll also use different cultures to see if it's a bacteria or a virus.
Okay, I see. Thank you. That makes sense.
No problem. We'll just take these samples and get those results to you. Hi, I'm back with your test results, and according to the results, you have viral meningitis, which makes sense considering your symptoms.
What does viral meningitis mean?
Well, it means that you have inflammation of the meninges caused by a virus. The meninges are found in the brain and spinal cord, and they're a protective layer between the brain and skull. And a virus is a very tiny organism that causes infections like this, and it needs a host to live.
Can you tell me more about this?
Yeah, so this is the most common form of meningitis, and it's usually transmitted by coming in direct contact with the person who has it. It's also usually caused by a viral infection like the flu, chickenpox, mumps, or measles. Because you have type 1 diabetes, you already have a weakened immune system, which led you to getting this disease. Also, because you had flu-like symptoms, you most likely had the flu or a similar viral infection. Viral meningitis is an opportunistic pathogen, so it affects people who have weakened or suppressed immune systems like yourself, since you have diabetes and had a recent virus. The symptoms you're experiencing are totally common for this disease. You might also begin to experience some irritability, lack of appetite, and sometimes sensitivity to light.
Okay, I understand. What treatment options are there?
So there really isn't a treatment for viral meningitis besides antiviral drugs to help fight the virus. So we can prescribe you with an antiviral medication, and you should also drink plenty of fluids and rest as much as you can to help your immune system. If you want to take an over-the-counter fever reducer or even some nausea medicine, that would be fine and would help get rid of your symptoms. But it should resolve naturally within 7 to 10 days. And if your symptoms get worse or doesn't get better within that time frame, please call here and we can get you back in to reassess. Do you have any more questions?
How can I prevent this from happening again?
Well, to start, you can avoid being around people who appear sick, and also stay home when you are sick too. Also, by washing your hands frequently and using disinfectants on surfaces you frequently touch will help too. You can also get a vaccine to prevent meningitis and yearly flu vaccines to reduce your risk of getting a prior viral infection. I'm going to give you this pamphlet that has some more information about viral meningitis, and we'll get your prescription of antiviral meds ordered for you. Thank you for coming in today.
Thank you.